Oh baby, yesterday my life was high heels and parties. Tomorrow it's high chairs and potties. Come along with me as we touch on everything from health and exercise to nursery preparation and childbirth classes. Today, how to survive the first trimester. No matter how good you are at taking tests, you may really never be prepared for the one that's going to change your life if you pass it. Once these two lines appear, you realize everything's about to be different. So after I found out, first I broke into a sweat, and then I told my husband, who also broke into a sweat, and then I headed to my doctor's office because nothing really confirms it until you hear it from your doctor. Meet my doctor, Robert Wilson, or as I like to call him, Doc Bob. As soon as my condition was confirmed, the next thing I did was decide I was not going to get morning sickness. Yeah, right. It hit me bad.
Patients in their first pregnancy, they'll have their morning sickness, as they call it, which can be all-day sickness.
Morning sickness usually strikes in the first trimester, 12 to 14 weeks.
There's a lot of estrogen and progesterone being produced by both the ovary and then later on by the placenta, and it's these hormones probably that make most of these changes.
And while the sight of certain foods may make you gag, there are some foods you just can't get enough of.
Start out with the old soda cracker routine, and as soon as you wake up in the morning, something dry in your mouth. That can be soda crackers, it can be dry toast.
If that doesn't offer relief, ginger has been known to help, but too much of it can also be dangerous. Relief bands are devices worn like a watch that deliver electrical impulses to acupuncture points on the wrists.
Let's talk about these wives' tales when it comes to morning sickness.
Okay.
You know how some people say, oh, well, if you have a lot of morning sickness, you're going to have a girl.
Wives' tale.
Is that true?
No, because it varies from pregnancy to pregnancy.
And that was the case for Andrea Rolkin, who craved cereal and Mexican food during her pregnancy with daughter Emma. But she's got her own beliefs.
I kind of have a tendency to believe the harder the pregnancy, the better the baby. That's just my own personal opinion, because my easy pregnancy, he is a total pill.
That's cool. Okay, good.
So it's still in there.
Still in there.
So now, at about 7 months, the nausea is gone, but the nervousness is beginning to set in. Next week, the dreaded screen test, which ones you need and which ones you can skip. Also, 3D ultrasounds, are they a gimmick or really worth a peek? Join me for our next Oh Baby report next Monday at 5.